Dr. Doreen Grand-Piché is the
Dr. Doreen is an expert in autism.
Doreen Grand-Piché.
Dr. Grand-Piché.
Dr. Doreen Grand-Piché.
Dr. Doreen Grand-Piché is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
She says, hi, Shannon, read half of your new book on the beach this weekend, and it's amazing. Thank you. My question is, how do we teach parents how to spot bad ABA and as BCBAs get more good, great ABA out in the world? Isn't that the quintessential question, Dr. Grand-Piché?
Really, what a great question. And of course, Shannon and I have spoken a lot about good or great ABA. And as a BCBA, I'm sure you'll kind of appreciate that, I guess good ABA starts with just understanding the concepts of behavior analysis well, understanding how to change behavior well. So having a really in-depth understanding of it. But then for me, I think you cannot be a good provider of ABA unless you see the individual that you're working with as a whole human being. And for me, that is crucial because, the human being is an organism that has a lot going on with it, and trying to control one behavior or alter one behavior at a time requires us to think of a lot of things like, how is this individual sleeping? How is this individual feeling from a mental health perspective? Do they have anxiety? Are they, fearful of certain situations that they've had traumatic experience with before? How are they doing internally? Do they have biomedical issues? As a nurse, I'm sure you'll appreciate that a lot of our patients have a lot of biomedical issues that we're not really dealing with because they have a difficult time expressing those to us. So is the individual feeling well, and also, of course, are there any allergies? Are there any situations that are making this individual feel tired or hyper aroused or so on? So to me, all of those things matter significantly. And then, of course, good ABA providers have to just have respect for the individual and for the individual's family, and to just, try to, I've had so many BCBAs where they're argumentative with the family because their perspective is a little bit different than what the family wants or the individual wants. And that's, to me, extremely important, Shannon. When we talk about, and there are a lot of people on the spectrum who say, what if I don't want to be changed? And that is something extremely important to respect and to say, absolutely. I mean, the whole purpose of ABA is to help an individual do more, thrive, feel better, succeed, etc. And if an individual feels that they're doing great, then, you don't need to embark on the whole world of ABA. So there's a lot there, and we could say a lot more. I mean, there's, good training of the staff, knowing how to follow a good curriculum. So you're teaching chronologically and by age level and so on. There's so much detail that goes into a good program.
And I thought you were going to bring up, and you didn't because you're kind, but I'm going to bring it up, that, we have written something that we keep saying we're going to put out, which tells parents, here are some hallmarks of a good ABA program. And I just need to dust that off and put it back out. Because I think it's this conversation that we had with last week's show where I was saying, look, there's a lot of bad information out there about ABA, but I always equate it to third grade. And I said last week, we've all been to third grade. And if I asked how many of you had a traumatic experience in third grade, many of you would raise your hand and say, or maybe it wasn't third grade, maybe it was sixth grade. You had a teacher who was subpar or horrible, right? Yeah. And we can all relate to it. It's not an urban myth. There's some bad teachers out there, but we never say, well, let's just cancel school. Let's do away with third grade. But people do that about ABA. And I think the reason why is we don't do it about education and we do it about ABA is that in education, you understand it's not always going to be good and you fight the system and you try to make it better, but you understand the basic principle of it is that it's going to help kids. Whereas ABA, if you don't have enough knowledge about what ABA is and you hear a bad story, you go, well, that's all of it. You don't have that contextual enough experience to understand that there's really good ABA out there and what the benefits of it could be. So you just hear a bad story and you go, oh, I don't want that. But I think that you and I and Dr. Barbera are also on this same page where we feel like if we empower parents and say, here are some things you should look for. But I always want to say to parents, if you are someplace and you don't feel like you're on the team and you don't feel like your child is being looked at as an individual, like what Dr. 𝗵𝗂𝗧𝗦 was saying, and an individual in terms of everything, how they feel inside and outside, if you're not feeling that with your team, then listen to your gut. Something's not right.
Yeah.
Right?
Yeah. I totally agree with that. You have to always go with your instinct as a parent. I completely agree.
And if your kid is thriving and happy and engaged and you walk in the door and people are nice to you and they treat you like a person and ask you questions about what choices you want, those are all the opposite of that. And that's probably, I think we always have to be diligent. Just like when you take your child to first grade, I don't just assume that everything is going to go swimmingly at school and the teacher's going to be fabulous and responsive to my child and automatically love my child. Yeah. I want to see what's happening. And if there's an issue, I address it. Right. And sometimes we get to the point where we go, this teacher is not a good fit. And I think we should be looking at ABA that way too.
Absolutely. Absolutely. I mean, I think with education, we just kind of take it for granted because everybody is in school and we're like, hey, this is what we're supposed to do. But ABA, we scrutinize it a little bit more.
And Dr. Barbera has written in and said, agreeing about the science as well, the focus on the whole child medical issues, respecting parents and the child, not being argumentative. Love that. Also love what Shannon is saying. I think we are kindred spirits. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now. To subscribe, click here. And if you'd like to check out some more of our videos, click here. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time on autismnetwork.com. We hope to see you there.